Hi, doctors. During the past few years, I've had problems with having to clear my throat all the time. Every few minutes, having to do that. It's really annoying, and it's gotten increasingly worse. It's a real pain and an embarrassment, and it hurts. Please, find out what it is and get rid of it.
Don't judge. It's not their fault. That's what today's show is all about, and to help Jane with her own annoying condition, we sent her to the Osborne Head and Neck Institute right here in Los Angeles for some answers. So take a look.
Nice to meet you. I specialize just in voice. So with that comes a little bit more of an involved exam. This is the video stroboscopy part of the exam, and that's going to let me try and figure out if there is a voice problem. I'm going to have you stick your tongue all the way out, and then I'm going to hold on to it.
You're going to hold on to my tongue?
I'm going to hold on to your tongue.
OMG.
What we're doing is looking at the strength of motion of your vocal folds. What motion of that degree means is that there is a problem, because essentially what you're trying to achieve is contact of the vocal folds. The left does not appear to be moving strongly enough to achieve closure.
Can it be corrected, or is it permanently damaged?
With good training, you can usually get 80% of it back. We're going to get you into some voice therapy aimed towards strengthening that fold again, getting you good closure. I think you also have a little bit of reflux, irritating your throat. Third problem, postnasal drip. Again, really simple treatment. Sinus irrigation, nasal allergy spray should cut all this mucus within a month.
I'm here with Dr. Reena Gupta, voice and swallowing specialist, along with her patient Jane. Welcome to both of you. Such a common problem. We see it all the time.
Absolutely.
Why do some people continually clear their throat?
The most common explanations are postnasal drip, mucus dripping from the top of your nose into your throat, or acid reflux, acid coming from above and landing up in your throat. Very uncommonly, there's a vocal mass, a polyp, a nodule, something like that. That is an explanation. Luckily, in Jane's case, we didn't see that. Really more the other two problems.
So what is the solution for Jane's situation?
To understand the solution, you have to understand the problem a little bit better. Essentially, what we're looking at with postnasal drip, for example, is mucus dripping from the back of your nose into your throat. And we have a really nice demonstration of that here. If you're looking at the back of the nose here, you can see how it's a straight shot to go from the back of the nose down into the throat. And when it lands there, if you imagine that this is your throat over here, normally we have mucus that goes down our throats all day long. Thin, clear, easy to swallow. So it's going to look a lot like this, just dripping straight down, no obstruction, nothing left above. Postnasal drip is a different problem. Allergy, viruses, colds, anything makes that mucus more viscous, more thick. So instead of pouring right through, it actually gets stuck. And you see this really goopy stuff.
That is goopy.
It is. And it just sits right there on the throat. You feel that. Your brain perceives it, and it makes you want to clear your throat. Exactly. The other thing that we had talked about was acid reflux. And that specifically is when acid from your stomach can't stay down. And so gravity, normally when we're walking around, keeps everything down south. As soon as we lay down at night, gravity isn't working in our favor anymore. Acid just pops right back up, ends up in our throats. The inflammation that causes makes us throat clear. And so the things that we do for that, really straightforward. Changing how you eat, what you eat, when you eat. And those things make you use gravity in your favor so that everything has gone far enough south before it has an opportunity to come back north.
Gotcha. Well, Jane, you're clearly in great hands here.
I am, and I do not have the big C. I am so relieved.
Well,
and this is
congratulations.
treatable. Yeah.
Excellent.